We're going to be spending the next couple of segments talking about COVID, including the pace of vaccinations and also how quickly we may expect to see a return to normalcy. But in this segment, we're going to be focusing on a particular group of survivors. The virus, it has killed more than 555,000 Americans. It's ravaged nursing homes and been particularly deadly for the elderly. And for the next few minutes, we focus on one particular portion of this group here. Tens of thousands of people who survived the Holocaust are particularly vulnerable, as they're all at least 75, with many of them much older than that. Of the estimated 350,000 Holocaust survivors globally, 1/10 of them live in the New York City region. Plus, it's estimated that 4 in 10 of them are living below the poverty line. Many groups, including the United Jewish Appeal or the UJA, they're helping to inoculate these survivors. I want to bring in our guest, Hindy Poupko. She's the UJA's Deputy Chief Planning Officer. She's kind enough to give us a few minutes. Hindy, I was surprised just more broadly when it comes to folks 85 and older. Only 42%, if I read that right, have been actually vaccinated to this point. Obviously, given the the sensitivity of the particular age group here and how vulnerable they might be. Why is that? Is technology a big hurdle?
First of all, thank you for having me and for raising this important conversation on population. Yes, certainly technology remains a hurdle. January may seem like many years ago to some of us, but it was only a few months ago when the vaccines first came on scene that one would literally need about 3 laptops operating at the same time with multiple websites up in an attempt to find a vaccine appointment. So it's no surprise, and frankly, it should have been no surprise to public health officials that seniors who are not digital natives had a lot of trouble. And for those that were not fortunate enough to have that digitally savvy grandchild making an appointment for them, many of them were left behind, and that's precisely when and why we stepped in.
You know, I mentioned some numbers off the top, but so many of these folks obviously isolated because of COVID, and a lot really up there in years, but 40% living below the poverty line here, that's got to be a horrible combination of factors, and that's why groups like yourselves stepping in here, right?
Absolutely. In many ways, New York, frankly, is privileged to be home to so many Holocaust survivors whose stories, one can argue, are more important now than ever. These are individuals who have witnessed and experienced the worst of humankind. And it is a painful reality here in New York that so many of them remain alone and wondering where their next meal will come from. Now, thankfully, we have a robust social safety net here in New York, and we take care of our most vulnerable, including our survivors. Many of them are Russian-speaking or Yiddish-speaking, and many of them, quite tragically, never got married again or had children or grandchildren that are able to care for them. And again, we are blessed here in New York that we have organizations like Self-Help, Met Council, the Claims Conference, countless organizations that UJA-Federation supports to ensure that our Holocaust survivors can experience their remaining years here on Earth in dignity.
One of the moving elements of this story, Hindy, is that I think a lot of this population doesn't fully realize just how important they are, and especially for what this world's gone through in the last year, how inspiring their resilience is. Did a lot of them get a reality check from not just groups like yours, but from the community for the appreciation? I mean, if not for them, if not for their perseverance, so many people wouldn't be here.
Yeah, I mean, as you're speaking, one moment that comes to mind is, so we have been working with our community partners, as you know, to ensure that survivors get vaccinated. And that doesn't only mean getting them an appointment. It doesn't take a historian to understand why a Holocaust survivor doesn't feel comfortable at a mass vaccination site. So a lot of the systems that the city and state set up to vaccinate seniors just weren't right for Holocaust survivors. So we set up vaccination pop-ups in culturally competent ways in their neighborhoods. And one of them that we did most recently was in the Borough Park neighborhood, home to many traditionally Orthodox Jews. There was a 97-year-old survivor of Auschwitz, and we told her that Mayor de Blasio wanted to come and say hi to her. This was a pop-up in particular that we did with New York City. And to your point about survivors being reminded of their incredible importance, and sort of the commitment that we continue to have for them, she broke down in tears. She said in her accent, "The mayor wants to meet me." And we said, "Of course the mayor wants to meet you. He had a commitment to survivors. He would be so honored to meet you." And to see her break down in tears was inspiring and also tragic, because it should be no surprise that they are most precious community and must be held with the utmost care and support.
Yeah, I can only imagine some of the trauma this last year's reintroduced for this population. Do you feel, Hindy, that major inroads in the last month or so have been made? Where are we in terms of how many people we still got to get vaccinated here in this vulnerable population?
We have thankfully moved the needle. In part, this is thanks to the commitment of New York City. Mayor de Blasio said very clearly a number of months ago that he would not rest until all survivors that wanted to get vaccinated were indeed vaccinated. Just to sort of give you a sense of what's involved in vaccinating Holocaust survivors. So think of a Russian-speaking survivor population. First of all, keep in mind that they have been targets of a terrible anti-vax campaign on the part of the Russian government. So first there needs to be education done. Then there has to be culturally competent and Russian-speaking resources available to them. So knowing about the anti-vax education of the Russian-speaking Holocaust survivor population, and of course their language needs, we hosted a pop-up in Bensonhurst in their area. They pull up in a Russian-speaking car service. They are greeted by their Russian-speaking social worker that they had not seen for a year, but are so happy to be reconnected with, and walk into the JCC, the Jewish Community Center, that they walked into so many days before this pandemic. So thanks to efforts like that, bringing vaccines to their neighborhoods with people they know and trust in culturally competent ways, we have significantly moved the needle. The work that we have to do and that lies ahead is with homebound survivors. This is not unique to the survivor population. Homebound seniors in New York and across the country continue to be left behind. Now, initially, public health officials said, wait till Johnson & Johnson. Guess what? Johnson & Johnson has been around for quite some time now, and yet many homebound survivors and seniors remain unvaccinated. We are hopeful, however, that through our partnership with the city and the commitment of incredible healthcare partners, that in the next 2 weeks, we will be starting a homebound initiative for survivors in New York City. But that is an incredibly complex and critical operation that has not yet begun, and that is where the work lies ahead.
Well, you're the last person I have to talk about how important what lies ahead is for folks who define perseverance, but I appreciate all the efforts you guys and others are doing on this front, and thank you for giving us a few minutes.
Thank you for having me.
We'll be right back, everyone. Stay with us.